That's right, you're back on DayBreak. My name is Raj together with Robin, and today we have a special guest who's going to talk a little bit more about sports medicine, in particular orthopedic surgery. And he is none other than Dr. Saw Kay Yong, the orthopedic surgeon from Kuala Lumpur Sports Medicine Centre. Dr. Saw, thank you for being on our show this morning.
Very good morning to you.
Good morning.
Right. Now, as we always do here on DayBreak, before we dive into the nitty-gritty, we always like to find a little bit more about your personal background and also a bit more about Kuala Lumpur Sports Medicine Centre.
Yeah. I was born in Penang, so
Right.
I'm a Malaysian. I'm born in Penang, and for the first half of my education until when I was 16, 17, I was in Penang, and from there I went to boarding school in the UK. That was before the university, and from boarding school I went to Liverpool University, where I did medical school. And after graduated from medical school, we have different options of what you want to do. When you go through med school, you need to decide, do I want to be a physician? Do I want to be a surgeon? If I want to be a surgeon, what type of surgeon I want to do?
And then when was the decision when you wanted to become a doctor?
Yeah, when I was young, I was always fascinated by the human body,
Right.
how things function. You like biology, you dissect animals,
Frogs.
or frogs. And then you look at the nervous system, you look at the musculoskeletal system, and you're intrigued by how all this works. And then
So it sort of sparked a curiosity
yeah.
at a very young age.
And then
right?
when
Okay.
you're sick, you want to know how you recover.
Yes.
But when I went to boarding school, I had a choice of, at that time, we're talking about late 70s, you have to look at your career. I wanted to do medicine, my parents wanted me to do business, but I also like, engineering, I like various aspects, different things. So I had various options, but I thought, okay, let's try for medicine and see what happens from there. So when I got to med school, you're exposed to all these different subspecialty,
Sure.
So you have psychiatry, you have general medicine, you have gastroenterology, you've got orthopedic surgery, general surgery, neurosurgery, all that.
It's probably thousands, is it?
Yeah. But I knew very quickly in my medical school days that I'm not cut out to be a physician. I'm surgical aspect is where.
You feel like you need to be more hands-on.
Yeah.
Pardon the pun, obviously.
Yeah, and if you look at all the different personalities that make up the different type of doctors you see, it's the personality.
Yes.
And surgeons are patients, doctors who are more hands-on. So as a child, we like to play with a mechanical set. We like to take things apart, put things together. And so it was fantastic when I did orthopedic surgery. If you know orthopedic surgery, we do joint replacements, we do knee replacements, and we have, very specialized power tools, screwdrivers, we have chisels, it's like carpentry, but a very high-tech carpentry.
Right.
So you can then have the option of doing what you like to do, hands-on, carpentry is in a way, but
it's
also
a lot more delicate, I'd say.
scientific way of doing things. So with a medical training, you have
Sounds like a big kid with nicer high-tech toys nowadays.
Pretty much.
That's right.
Right.
That's right.
Fantastic. Now, moving on to current times, can you just tell us a bit more about Kuala Lumpur Sports Medicine Centre?
Yeah, Kuala Lumpur Sports Medicine Centre is concept that we started up more than 10 years ago.
Okay.
At that time, myself, Dr. Tay Yong Guan, my other colleague, and Dr. Sharin Marican, he's a radiologist, and three of us were working in Gleneagles Hospital in KL. The problem we had was that we wanted to do things quickly, and sometimes major hospitals have got restrictions for what you can do, and we were getting patients from abroad and patients from Indonesia coming in, and it's very difficult for patients who come in to see you, and you tell them, yeah, you can see them, you can examine them, but I'm sorry, I can't do an MRI scan today until 2 days or 3 days later.
Because it's like a waiting list, you have to make a schedule an appointment.
Yeah. Because they're foreigners, they have to travel back to their countries later on, and things like that. So it's a huge burden.
It's very difficult as a patient, and if you want to treat health tourism patients, it's impossible to do that. So we thought, between me, Dr. Tay, and other doctors, why don't we do something different?
Right.
So the concept of KL Sports Medicine Centre, we conceived the idea, having coffee in the morning, and basically we wanted things that we can do quickly, and we wanted a very structured way of doing things with collaboration with nurses, physiotherapists,
Sure.
patients, and all that. We wanted things that's integrated.
Right.
But major hospitals, they don't look at things differently. So
Yeah.
we are more like a boutique
Right.
place that we can do things
Right.
very differently, but more efficiently and quickly, and
Right.
produce a quick
Now the
results.
big question is, why sports medicine in particular?
Yes.
Yeah, you see, if we just call ourselves Kuala Lumpur Orthopedic Center or something, it doesn't differentiate us to give us a branding.
Sure.
So we wanted something that people can identify, what we do, and each of us saw different problems. After a while, we wanted to do subspecialty work. So in the early days, we were doing trauma, we were doing on-call, we were fixing fractures in the middle of the night. We were also seeing knee problem, ankle problem, back pain, hand problems and everything. And then we started working with like-minded people, So we had Dr. Ranjit in, and he's a hand surgeon, so he's interested in hand. So we could send him all the hand problems to see. And then we had Dr. T.C. Lau, who is a foot and ankle surgeon, who now treats all our foot and ankle problems. And then we have Dr. Aman Ong, who
So
does
basically, in the
spine and
center, you
hip.
have all the doctors that cover different sections of the body
Yes.
at one place.
At a different level.
At a different
And
level. That's fantastic,
Yeah,
Raj.
so
Yeah, it is.
if you look at the future, if you look at the West, for example,
Right.
you look at America, you look at the UK, there's always people who do subspecialty work,
Right.
And like, if you see a hand surgeon like Dr. Ranjit, he can see a simple sprain to microsurgery to an amputated finger, a wrist, and replant all that. So,
Wow.
so the depth of knowledge, it's so vast, and
Right.
this is what you need for subspecialization.
Yeah, I think that's,
Yes,
that's very,
yes,
very
yes,
crucial.
yes.
Now, one thing is, we know that private hospitals, they are huge, and don't they also have their own like sports medicine division to handle all the different situations you have mentioned just now?
But most of that sports medicine work is under the umbrella of orthopedic surgeons.
All right.
So if you go to a major hospitals, you will see 20 orthopedic surgeons there, and some may put interest in shoulder or knee or
Yeah,
whatever, or
yes.
hand or whatever. But it's not as developed as what we are doing as a group.
Yes,
You know?
yes, yes.
And we have the physiotherapy rehab as well in addition to that.
Because you have the time, you have the sources, and also because it's like
Because we're
it's-
small. you know.
Exactly. It's
We're
easier to
small
control.
and,
It's
and,
easier.
and,
Yes.
and we are small. We are the pioneers, and we had ideas of what we wanted to do. And all my partners,
Yes.
we've been abroad for many
Sure.
years, and we've been back, and we've traveled a lot. So we see different ideas from different parts of the world, and impart our own ideas of what we think, what we like to
Yes,
do.
you can actually come back and implement it straight up, just by yourself.
That's right.
Yeah. Which you cannot do in a hospital, per se.
It's not you can't do it. It's just a bit more difficult to do it.
I see. I
Bureaucracy,
see.
red tape, and approvals and all that, I would imagine.
yeah,
a bit
yeah.
more
Now, speaking of that, when you set this medicine center up, I would imagine the investment, the initial startup cost would have been truly immense, given the fact that the cost
Sure.
of equipment, machinery, all
Equipment's
this-
alone, I can
yeah, I
imagine.
can be talking about in
Wow.
the millions, right?
Yeah, I mean, when we conceived this idea, everybody thought we were crazy. But we had our accountant to advise us, and we
That's
look
right.
at the sums, and we look at, we were not doctors who just starting out our practice.
true.
We are more or less established. We have patients,
Right.
that can come and see
Yes,
us, whatever.
yes,
But
yes, yes.
yeah, there's always a risk. I mean,
course.
you can't try to do something without risk, but it's a calculated risk.
Of course.
So what are you going to get at the end of this, or do you just want to stay in your comfort zone and
Well
not
said.
progress? I mean, and it's like everything else. It's like medicine. It's like your career. What you want to do? Do you want to travel? You want to do different
Exactly.
things?
Exactly.
But if you don't push the frontier of medicine, like what we're doing, stem cells and everything,
Right.
then you're not going to get to the next level.
Okay. Well, I have a question. Let's say if I'm a patient, all right, I've got a slip disc, all right, so I go into your institute, what happens? What are the processes? Knowing that it's very efficient, very effective, so I want to know exactly what are the processes.
So if you have a slip disc, you come to our office, we will refer you to Dr. Aman Ong, our spine surgeon.
Okay.
Um,
So I
if
walk
it-
in and I see the doctor straight away?
No,
or-
if he's not there, one of us will see to you. It's not an issue. I mean, we're all general orthopedic surgeons. We can do general orthopedics. We can do fractures. We
Yes,
can do
yes,
lots
yes.
of
Because
things.
you
but-
understand it all, basically.
Yeah, but we've chosen to do a subspecialty work. But when you come in, eventually you'll see the consultant who looked after your spine,
Right.
and the likelihood is that he'll probably ask for an X-ray, and if not, an MRI scan as well after taking a history from you and examination. You know, one of the things that I find that is as a lost art now is the art of practicing medicine. You know, that is something that patients sometimes do not realize. Now people depend a lot on images, you know, X-ray, MRI scan. They think you can diagnose everything, but it's not, you know. And it is still the art of taking a history from patient, examining the patient properly, do a neurological examination, and then come up with a differential diagnosis without even looking at X-ray, MRI.
Basically,
scans.
engaging with the patient, asking questions,
That's right.
which is more important,
And
rather than relying
examining-
on just technology.
And examining
Personalizing the
patient.
experience.
Yeah, and that is the art of medicine that I see that unfortunately is lost somewhere in transition.
Yes,
because
you're
of
right.
modern technology. That's a
Yes,
shame.
yes.
Because that art of
Yeah.
medicine is not something that you can read from the books,
That's
and it's
right.
taught by consultants that you've
Yeah.
attached to.
I mean, you said here
through medical
somewhere
school
that
and everything.
happy patients heal faster. Right?
Definitely,
Yeah,
definitely
yeah,
makes
yeah.
sense. All right, Dr. Saw, just hold that thought for a moment.
Yes.
As you can see, we have gotten a little bit insights with regards to what sports medicine is all about, in particular orthopedic surgery. Now what we're going to do is we're going to take a quick commercial break. If you have any thoughts, as always, you can email us at updates@Capital TV or tweet us at the Capital TV right now. Now, when we come back, we're going to talk about something radically new, taking the world by storm in the world of medicine, which is stem cell research. Now, to find out more, please stick with us here on Daybreak.